What is your experience of a stem cell transplant, given you've been through it twice? I'm thinking of viewers who might be facing it themselves. How difficult is it to go through that?
It's quite a big phase treatment to go through both times, but this time it was a bit easier to cope with. And what they actually do, the procedure for the stem cell transplant, is that they have to sort of give you a full, do lots of checks to make sure that you can actually you're healthy enough, fit enough. And the chemotherapy that give you is melphalan, which is the ones that are actually supposed to if you've got any disease left in your body, it's supposed to clear that out. And then followed by 2 days later, they actually infuse the stem cells into you through a Hickman line or through a cannula, which was in my case. And I couldn't get a Hickman line in my case, so I had to have a cannula. It took about 2.5 hours to actually get the stem cells back into my, it was 2 bags, and about 2.5 hours or so.
Does it just look like a transfusion bag or something special?
It just looks like a transfusion blood bag, just red, you know. And then I couldn't see the cells or going in, but they know that if the 2 bags they had that went into your body, they'll get there somewhere. They'll work their way into your hips and the bone marrow and things like that.
And do they give you any advice about what you have to be cautious about afterwards?
Yes, I was actually kept in for, usually when you actually go for a stem cell transplant, you go into a ward then after a few days, because you become, all your counts and everything is gone low, and it takes about a week for your counts to drop down. Then they stay dormant for about 2 weeks, then they start rising on the 3rd week. And so they put you into a side room, so you're on your own. And I was very, very poorly, and most of the time I was actually had diarrhea, you know, so and then you're on various drips, so regularly you go into the toilet, pass water, and you very rarely get any sleep, and you're just exhausted, but you are going back and forth. One thing that I found that this time round was that to compare to last time when I actually had a stem cell transplant, I was actually also sick a lot. So any food that I actually ate or brought up. But as things have I see a remarkable improvement. I was given anti-sickness tablets, and I wasn't actually sick, as in bringing food up, and the quality of the food was actually also very, very good. And I think they overfed you at times, they did. And I felt really weak, and it was expected that you're going to feel weak. And then slowly, as your cell counts recover, you get stronger. But
how long overall until you really start to feel more like your normal self after that stem cell transplant?
I would say now, it was actually early December, which actually had a stem cell transplant.
Okay, now it's
only
March.
now, more or less now, March time, that I'm actually feeling
more like your normal self.
More like normal self.
3 months or so.
Yeah, and prior, how I used to feel before the transplant.